I remember days they used to laugh at me. Used to show them on my records talking casually. Used to say it was a passion on my path to be. Then they told me that I couldn't, so I had to be. Tell me what they really think about it now. Used to hate it, but I guarantee they're proud. Had to do it just to show them that I could, yeah. Now I finally think I took it where I should, yeah. Had jokes on you and now you're on and laughing. I did a whole lot of winning. Look, it came from a passion. I see a whole lot of no ones I could see now in public. And that may think a lot of things, man. At least think something, now you the judge. Hey, now tell me where you ended up. Yeah. Look, I bet it was a simple job. Yeah. Look, I went and took a different route. Yeah. Look, that's why my life is different now. Back in my feelings, look, when I wasn't so gifted and I was learning to do this, and all I heard were the critics, and I don't blame you for that shit. Look, I was way out the basis, but I just needed some talent so I could wait this to greatness. Oh yeah, you ain't ever think this, no, no, no. Stop me while I started, homie, whoa, whoa. Now this shit settled, it's go better and better. But I'll always remember, yeah, yeah.
Dr. Doni Wilson, welcome to That One Podcast. Glad to have you here.
Great to be here. Great to be here with you.
Yeah, no, it's my pleasure. It's my pleasure. Let's have a little pissing contest of who's happier to be here. I'm happier that you're here.
Oh, thank you.
Yeah, no, my pleasure. You're sitting up in New York right now. And did you grow up there?
I didn't. I grew up on the West Coast. I grew up in Portland, Seattle, that area. I went to Bastyr University in the Seattle area. That's where I got my naturopathic doctor degree and my midwifery degree. And then I moved to the tri-state area, New York, Connecticut. And I moved here right after 9/11, which was a very stressful time to move to this area. But it really fits in with what I ended up focusing on in practice, which is how stress affects us as human and how to help humans recover from stress. How do we stay healthy while we're stressed?
Yeah. Well, that was a pivotal moment, but also the COVID was a pivotal moment for New York City as well, right?
Absolutely.
Yeah, can you kind of talk about that? What was that like being there during that time?
It was, everything really shut down. In fact, now it's 2025. So we're now I'm starting to see more people, more humans that want to come into the office. What happened with the pandemic is New Yorkers just wanted to stay in. They weren't leaving their homes, their apartments. And that stayed for years. People were really, even I have patients who live a block away and they weren't coming into the office. So it really had a huge impact on New York City, the pandemic. And talk about a stress that we've been recovering from. I'm still seeing patients recovering from even having PTSD from dealing with the pandemic.
Yeah, I mean, just think about how many people had to go to the hospital and none of their family members could come to visit them. Some were dying and couldn't see their family members like one last time. Funerals, you couldn't go to the funeral home, and there's all kinds of different things that happen, like that just caused so much chaos. Yeah, let's call it.
Her husband was a pilot, so they were afraid that he got exposed to the virus when he was flying a plane, and then he had to quarantine in the basement of his home for weeks. Because they didn't yet know how, it was before we knew really how to test and how long does someone need to quarantine. Can you imagine being quarantined in your basement for weeks? And we went through that.
Yeah. It seems like a weird dream, doesn't it?
It really does.
I mean, and by the way, it's not that long ago, but it is long. It seems like a long time ago. You know,
thank goodness it's been years. But this is the impact of stress on us, Mike, is like we go through stresses like this as humans, sometimes big, major stresses. And in the moment, we might even be aware that we're stressed. And then we think, oh, now the pandemic is over and everything should be fine now. But no, in our memories, we remember how it was. And the way I look at it is there's an imprint in our stress hormones as well. Very likely the cortisol levels, which is our main stress hormone, is still reflecting the stress we went through 5 years ago.
Wow, I didn't know that. Mm-hmm. So how can you reset that or clear that out?
That's exactly what I spend a lot of time helping patients with. One is, first of all, I always like to measure patients' cortisol levels first Because for some people, when they go through a stress, their cortisol gets stuck too high. And a lot of people assume their cortisol is too high, but at least 50% of the time, it's not too high, it's too low.
Whoa,
So we
I
need
didn't know
to
that.
find
There's a
out
low
first.
cortisol level.
Yeah, there's such a thing as a low cortisol. And some people have a little bit of both. Sometimes they have too high in the morning, too low in the afternoon, or vice versa. And if we just guess that we have high, then we're doing the wrong treatment, because to get it back to optimal, we would use different herbs, different nutrients, and I would argue we would even use different exercise routine, different sleep schedule, different even meditation and other activities like that should be different based on where your cortisol's stuck, right? So we want to find out where's your cortisol stuck, and then we're going to create a plan to get it back to optimal based on your body, your system.
So is there some times where people's cortisol is so low that they're not getting stressed enough and they need to stress?
It's a good way to say it.
Nobody ever talks about that.
Actually, yeah, and what ends up, they feel fatigued and they feel unmotivated and they feel uninterested and even depressed, and they just feel like blah, right? They're like, I wish I could get and even their adrenaline could be low too. And so then they're just like, I don't feel like doing anything, right? That's what that looks like. And so they need some optimal stress. And the way I came to this is originally when I was getting my midwifery degree. So I was training as a home birth midwife, and I had to do research along with that. And my research was, how does stress affect women in labor? And so this is back now over 30 years ago. I was doing this.
By the way, the husbands get stressed too. I watched two of them, and I know that affected me in some way.
Yeah. Okay. Now I'm going to do another study. How does stress affect men in childbirth? Absolutely. But it's probably similar, because what I learned from the women is that it's about how do we get to optimal. You know, that's the thing, is whenever we're under stress, whether labor, childbirth, a pandemic, what we want to be thinking about is how do we optimize our cortisol and adrenaline through the stress that we're going through. And so that was what I learned from those women. And then I applied it after 9/11, and I applied it through the pandemic, and I applied it for men and women and children for that matter. They go through it too. And it's like, we need to help focusing on how do we get our cortisol and adrenaline levels optimal, because when it comes down to it, cortisol, which is our stress hormone, and we mostly think about it when we're stressed, but actually cortisol is working for us 24/7. Cortisol is impacting our digestion. Cortisol is impacting our immune system. Cortisol is impacting all of our hormones. Cortisol is impacting our nervous system. Cortisol is impacting how well we sleep, how we think, how we feel. It's impacting so much. Even our microbiome is impacted by cortisol. Our fertility is impacted by cortisol. Our susceptibility to infections is related. Our susceptibility to all different health issues, from heart disease, diabetes, dementia, you name it, are all related to our cortisol level. So if we're not paying attention to cortisol, what are we paying attention to?
Yeah. What are some of the herbs that people can take that have high cortisol?
So if you have high cortisol, and you know you have high cortisol, and again, I would test it. You can at least do a blood test, or you could do a urine or saliva test. And if you see I have high cortisol, then the one you hear about most often is ashwagandha. You've probably heard of ashwagandha.
Yeah, I take ashwagandha. Yeah.
So ashwagandha has a lot of good research on helping to reset cortisol that's too high, bringing it back. And we're not trying to shut it down to zero either. We don't want zero. Remember, zero makes you feel like blah. So we just want to use enough to bring it to optimal. So ashwagandha is really good at that. But I actually really prefer an herb called banaba leaf, Banaba. It sounds like banana, but it's got another B in there, banaba. And banaba leaf also really good at helping to correct high cortisol, along with phosphatidylserine. Talk about a tongue twister, but sometimes you'll just see it called PS or PS 150. It's a nutrient, phospholipid, phosphatidylserine, which helps reset. What we're doing is we're actually resetting this signaling in the brain, because what happens is when we're under constant stress, and by the way, constant stress can actually also come from over-exercising, because if we over-exercise, it's a stress response. It can also come from fasting for too long. there's a lot of things that can trigger this overproduction of cortisol. And then in the brain, there should be a turnoff, like a turnoff valve, right? When you get too high cortisol, it should turn itself off. But what happens is when we're constantly pushing that, the turnoff valve stops working. So then it just allows the cortisol to stay high without ever resetting it. So what we're doing with these herbs and nutrients like phosphatidylserine, ashwagandha, banana leaf, they've been shown in research to turn the turn-off valve back on again so that it can recorrect itself.
Gotcha. And now ashwagandha, is that bad to take if your cortisol is too low?
It's not bad, but it's probably not going to help very much, you know?
Right,
so if the cortisol is too low, I'm going to be thinking of herbs like glycyrrhiza, which is also known as herbal licorice.
I thought you were going to say cocaine. No, I'm just kidding.
Cocaine
I have a weird sense of humor.
Adrenaline. It definitely might stimulate your adrenaline.
Folks, do not listen to me. Okay, listen to Dr. Doni, but do not listen to me. Okay.
Well, the way I always say is like it's much smarter to take substances because we have all kinds of substances we could possibly take out there.
Yeah.
A lot of times we reach for caffeine for one or alcohol, but we also have to think: is this substance that I'm consuming? Is it going to be beneficial? And is there any risks? Is it a toxin to my system? Am I going to be potentially addicted to this substance? Is there going to be withdrawal symptoms? And if we don't think about it that way, because we're used to thinking about that with medications, right? Like if I'm going to take this medication, is there a potential side effect? Am I going to become addicted to it? Is it going to be hard to stop it? But that is also what we think as a naturopathic doctor and clinical nutritionist. I think about that with every substance, any herb, nutrient, drugs, anything. What's the potential risk? And then we weigh it out and we say, how about we try the things that have the least risk first?
Right. Yeah. And by the way, also the foundational things, the easy things like good sleep, good diet, exercise.
There's no risk with that, right?
Yeah.
Like, hey, now there is a risk of over exercising. So we could go, okay, yes, let's exercise, but we also have to go, okay, but we don't want to overdo it because now like say someone who's training, like maybe if they're training for a marathon or any kind of athletic activity and they're training too hard without enough rest and recovery, they increase their risk of injury. Yeah.
And the stress part too, because the cortisol can go up.
So they're aware of that. They're like, oh, or they find out because they hurt themselves and they're like, I better back off a little bit here. So sometimes things that seem good for us could even be overdone. So we have to, I would say, like with everything, kind of say, it's what we call the Goldilocks effect, right? That Goldilocks story, which was still a story when I was a kid, maybe it's not so much now, but Goldilocks, who was like, hey, is this chair or bed too small or is it too big? Let me find just the right size. Or is this porridge too hot or too cold? Let me find just the right temperature. We need to implement that all the time for ourselves as humans. We tend to go for the extremes. We tend to go, if I can do this much, I can do more is better, right? I'm going to keep going for more because more should be better. But that's where we actually end up failing and harming ourselves is because we overdo it. So we need to instead say, where's my sweet spot? Where's just enough of an exercise or a weight that I'm lifting or sleep even? What's just the right amount of sleep that your body gets the benefit without, if we do too little, it's not good. If we do too much, it's not good, but just the right amount. And it can vary from person to person.
That's what I was going to point out too. Yeah, it's everybody's different. So when you're watching social media and you're seeing all these things, you go try these different things and with no way to really gauge if it's working. Like one thing in life, you have to be able to keep score to know if you're making progress. If you don't have a way to keep score and see data and markers, so many people are buying all these products. There's billions of dollars being spent on things just because they see it on TikTok or Instagram.
Yes.
And they don't even get their blood work done or anything. I
say it's like you're going into a dark room and you're just throwing spaghetti at the wall and you don't know if you're even throwing it in the right direction or if it's going to stick, if it's going to do it. It's just, you're just blind and just doing randomness, hoping it's going to get you where you're trying to go. But if we're trying to go from here to the grocery store and we don't know where the grocery store is. If we drive randomly in different directions, what's the likelihood we're actually going to get to the grocery store?
And everybody is guilty of this. I've done it before where I was like, oh, I'm going to take ashwagandha, or I'm going to take, I don't know, something else that I thought was going to work just because I saw it somewhere and it was very well marketed. Marketing wins a lot of times, not for the individual, but for the company. So you had your own journey. We all go through our own journey. You've had your own health journey, and part of it was overcoming migraines. Can you tell us about your journey and what that entailed?
Definitely. And I would even say it started even before, even slightly before the migraines. Like, I realized looking back, I say I grew up in a pharmacy. I'm the daughter of a pharmacist. So my father ran a chain of 1,200 pharmacies. And throughout my childhood, that was the main commonality, because we moved a lot for him to be working in different aspects of that pharmacy chain. And so I didn't have a consistent home. We were constantly moving. The thing that was most consistent was going into the pharmacy. And I had a bird's eye view of the pharmaceutical industry starting from a very young age. And we even worked for the pharmacy chain when I was in college. Meanwhile, I was getting my pre-med degree. And while getting my pre-med degree, I was thinking to myself, what about nutrition? I'm really interested in nutrition. And so I literally decided to also get a degree in nutrition. So I was doing a pre-med degree and a nutrition degree. And it allowed me to see that there was a possibility of the two working together. And at that same time frame, I started having my own health issues. It started with GERD. Actually, I was getting reflux, and I'm like, why? And of course, the first thing was, oh, you can take this antacid for your reflux. And I tried the antacid, and I had every kind of side effect to it. It didn't even help me. And I was like, I'm not going to take that anymore. So then I was already in a situation from a young age of saying, oh, this medication is not helping. What else can I do? I also, at that time, was taking a birth control pill, had side effects to that. And the doctor's like, you cannot take birth control pills anymore. And I'm like, why? Why is this happening in my body, right? So here I am, grew up in the pharmaceutical industry, and I was reacting to every pharmaceutical, even with the migraines. So then the migraines started happening. And I couldn't take nothing. Either the medication didn't help, or it made me react to it and it felt worse. So it wasn't helping to take, normally someone would take maybe an Advil or even one of the migraine medications. I couldn't do that. It didn't help. Or with my body, I would get so nauseous with the migraines, I couldn't even swallow anything. So it was at that same time that I was doing internships as a pre-med student. So I was doing internships with every kind of doctor, surgeon. I was in and out of surgeries. I was trying to figure out, what kind of doctor do I want to become? What does my future hold? And I started working with a gynecologist, because at that time I was also dealing with my own gynecology issues. And I was like, this seems like something where women really need more help. And I became very interested in women's health at that time, working for the gynecologist. And one day I saw a sign for a midwifery clinic in the gynecology center. And I said, what's that? And that was when I get those moments of clarity. And I was like, wow, this is a women's health practitioner as a midwife who helps women to look at their whole body, integrate in nutrition, a more supportive options, not always going straight to a pharmaceutical or a surgery. And that really piqued my interest, because that sounded more like what my body would do well with. And so at that time is when I was finishing my degree in pre-med degree and nutrition degree. And I had the thought, first of all, I want to become a midwife, but also I want to study medicine that uses nutrition. It uses food as medicine. And that's when a friend of mine said, well, what about naturopathic medical school? And that's when I was like, let me find out. Now, this is before Google, Mike. So It wasn't that I could just Google it. I had to get in my car and drive there.
Right.
But I walked in and I'm like, I want to study medicine that includes nutrition. I want to study food as medicine. And they said, that's exactly what we do here at this was at Bastyr University in Seattle, Washington. And that's when I just knew this is what I'm going to do. I'm not going to go down the path of the pharmaceutical industry and the conventional medical industry, because I want to be, this is what's going to help my health, and this is what can help others. Now, with the migraines, mind you, even when I was in naturopathic medical school, I tried every herb, every nutrient, acupuncture. Still, the migraines were not going away. So I came out of naturopathic medical school and researching stress and helping people with stress, but I was still getting migraines. And I felt like such an imposter. Right. I was like, how can I be a naturopathic doctor getting migraines and I haven't figured this out yet? Oh my gosh. So it took
what worked? What finally worked?
The thing was, it was a process of trying this after this after this. And actually the migraines, I'm so grateful to them now because they pushed me to keep on researching, and I was not willing to give up. And I think this is a message for everybody. When you have a health issue that you've been told this is impossible to go away, right? So many people are told migraines are never going to go away. You're going to have them forever. We're told autoimmunity is never going to go away, or, certain viruses. I help a lot of women with abnormal pap smears and high-risk HPV virus, and women are told it's never going to go away. So I was just the person who just didn't believe that, right? I'm like, okay, it doesn't go away based on your system, based on the pharmaceuticals and the surgeries, it doesn't go away. But I'm still going to figure out a way. And so with the migraines...
How often were you getting them, by the way?
I was getting them sometimes twice a month. And whenever I would get a migraine, it would take me out for days because I couldn't work, I couldn't talk to patients, and I would oftentimes go into vomiting because the pain would cause vomiting. Wow. So it would take me, there was times where I'm on the bathroom floor going, oh my gosh, I have to figure this out because I'm in so much pain and I have patients who need me. And that's when I would get these epiphanies. And the epiphany was, I have to create time for myself. I have to create self-care recovery time in my schedule, because otherwise I'm going to end up in pain. Now my body's giving me a break from work, but I have to be in pain and not be able to function in order to get that break. So one day I was like, what if I just start creating time in my schedule where I actually take breaks, where I actually do something I enjoy? Because I was literally workaholic. Many probably people can relate to that, right? Where we just we keep pushing ourselves, just like you and I were talking about before. There's such a thing as too much of anything. There's such a thing as too much working too. Yeah. And
so it was, so it seems like it was more of a process of elimination versus addition.
It was a process. I had to eliminate certain foods from my diet. Gluten was huge, gluten and dairy. I figured out that I had sensitivities to gluten and dairy. I had to figure out how to heal leaky gut because I had severe leaky gut. I also had imbalanced cortisol levels. I had to figure out how to rebalance my cortisol and neurotransmitters. I also had toxicity. I finally tested and I had high levels of formaldehyde in my system and figured out that I had been sleeping on a memory foam mattress filled with formaldehyde.
Oh my goodness.
And I threw out the mattress, got an organic mattress. So this is speaking to, it's worth it to pay attention to the toxins in your home. I had to then help my body to detoxify. Yeah. So I had to get rid of some stress, get rid of some toxins, get rid of some foods that were inflammatory. And even I had toxic relationship in my life, emotional toxicity. I had to work on that, get that cleared out. And it was
can you elaborate on that? Like, what does that mean?
That's what I refer to when we're in, whether it could be a romantic relationship or even a work relationship, where sometimes now we hear the terminology narcissism or narcissistic abuse, but to me, it's also on a spectrum of toxicity where if you're relating to this other person and it's constantly chaos, constantly stress, constantly feeling like you're at your wit's end, and confusion and depression and anxiety dealing with this other person in your life, to me that's a toxic relationship, because now you start to become critical of yourself. You have lower self-esteem, lower confidence, and these stressful interactions with this other person end up affecting your whole life and your health.
I spent my life dealing with a lot of that.
You sound familiar to you, huh?
Yeah, and it's another term called antisocial personality that people have, and they're destructive. You know, it's a destructive thing. You got to identify those in your life quickly and cut them out. You got to handle it and cut them out, because if you don't, everything can suffer, and you suppress your personality, your beingness.
Yes.
And you can't live life to the fullest if that's the case. So I'm very hyper intentional with the people I keep around me in my environment. I have no tolerance. It's a non-negotiable, you know, and, I grew up with a lot of brokenness around a lot of people that had issues. And if you don't have issues, you don't need to be in those environments just because somebody else does. That's not, and so many people are so unwilling to handle that and confront it and separate themselves from that, because they're like, well, that's my family, or it's my best friend, or it's my spouse, or it's my kids or my parents, whatever. Let me tell you something. I don't care who it is. If it's going to suppress you and pull you back from the full beingness that you have the capability of doing, you have to do it, or you're just going to live a miserable life and unhealthy, right?
Absolutely. And so this is where I went through that, and I started to see all these different stresses of different forms, right? Emotional stress from relationship, toxins as a stress, as well as work as a stress. And all of that builds up. No wonder I was getting these painful migraines. The body was trying to tell me, you need to stop, look around, and change some things. And that's what it finally took for the migraines to go away. But I'm so glad to be free of that pain in the migraine form of a migraine is so worth it. But you're right. We have to be willing to stand back and look around and say, wait a minute, is this relationship harming me? And if so, what can I do to protect myself? Because sometimes when we're in a toxic relationship, we can feel stuck. It can feel really hard to get out. So to be able to get support through the stress so that you can regain your confidence and create a plan for how you can finally get out and recover from that toxicity.
Yeah. Yeah. You don't need permission from anyone to get out of those kind of relationships or away from those people. By the way, I'll give you permission. If you feel like you need permission, folks, I'll give you permission, but you don't need it. You have to take agency over your life and your environment. It's imperative. So the other thing is, when is it the good time to use naturopathic methods versus drugs? And when is a good time to be like, okay, it's okay to use a drug now?
It's a great question. And I think, like I was saying, I think no matter what we're confronting in terms of a health issue, at the very least, to stop long enough and think it through and gather all the information. Like you said, you got to test, do the right tests, and they might not have those tests at the standard doctor's appointment. So you might have to go through a practitioner like me or functional medicine practitioner to get the right information. And then you look at what are all of my treatment options, and then decide whether a medication makes sense. But too often we go straight to the medication, or we go straight to the surgery, and we skip over, oh, you mean I could have made a diet change? I could have changed my lifestyle. I could have taken an herb or nutrient to solve this instead of, because a lot of times what happens with medications, especially with the millions of people dealing with, let's say, anxiety and depression, and they're going on medication, or pain, physical pain, and going on medications that have an addiction, and then they're really hard to get back off of. They have withdrawal symptoms. Then, it's still possible. I help a lot of people in that situation once they've needed to take a medication, but now they want to try a different route. There's ways to do both. We can use natural approaches alongside a medication to decrease your need for the medication and gradually come off of the medication, because a lot of times these medications are, we feel like we're stuck on them, and they may not even be that effective.
Yeah. Yeah, I agree 100%. Now, there's another question I had regarding Oh man, what was it? I lost thought on it. All right. So now women, what's something as we wind down here, what are some things that women should be focused on when it comes to their pelvic health and, being proactive about these things?
All of these things we're talking about in terms of your knowing that your vaginal health is related to your whole body health. A lot of times we think we're separate parts of our body and it's a separate issue, but actually vaginal health is very much connected to the rest of your body. So when I'm helping women with their vaginal health, whether that's fertility or recurrent vaginal infections or high-risk HPV and abnormal pap smears, all of those, we're going to say, hey, is there inflammation that we need to decrease? We can change your diet to decrease inflammation. Is there a hormone imbalance like estrogen, progesterone? And how do we help rebalance estrogen, progesterone, whether that's when you're menstruating and helping your ovaries do a better job of producing healthy hormone levels, or when you're postmenopausal and using bioidentical hormones to balance hormones. We also need to look at the microbiome, because we know that the gut microbiome influences the vaginal microbiome. So we need to be looking at is there an issue with your microbiome and how can we rebalance it? And or nutrient deficiencies and blood sugar levels for that matter. So I look for, is there any imbalance in your whole body? And let's address that, because we know that's going to improve your pelvic health, your vaginal health. And the thing is that now it's estimated that every year there's at least 13 million new high-risk HPV infections, and more than 42 million Americans, that's men and women, are dealing with high-risk HPV. So this is a common, we used to think this was an uncommon virus, but HPV, high-risk HPV, is actually a very common virus for men and women. And when I say high risk, what I mean is it's associated with cancer risk. So for women, the one we hear about most often is cervical cancer. There's also vaginal cancer, vulvar cancer. But for men and women, it can be also correlated with head and neck cancer. So usually it's in like the tongue, the esophagus. Throat cancer can be caused by high-risk HPV. And high-risk HPV is transmitted sexually. So it's something that the way I look at it is, we most all are going to be exposed to high-risk HPV. Even if you have one sexual relationship, it's very likely you're going to at some point be exposed to the virus. They say 80% of us are exposed by age 50. So it's not about us or them, or it's not going to happen to me. It's pretty likely that we're going to all get exposed to this virus. The key is to know that the human body can clear this virus. The human immune system and the human microbiome and the vaginal microbiome can clear the virus and protect you from cancer, but you're not going to hear that from the standard medical system. And so a lot of women get caught in going for repeat PAP and biopsy and procedures, but the doctors are never helping them stop the virus from causing a recurrence. And so it becomes this insidious, vicious cycle, and women are embarrassed to talk about it because it feels like this is something that we don't talk about. It's a taboo topic. But so I'm here to say this is an important topic for men and women. And as humans, of course, humans get exposed to HPV and humans have sex. This is an issue that we're all dealing with, whether we like it or not. Better to talk about it so we can prevent cancer, because there are ways we can prevent cancer.
Yeah. Isn't it amazing how powerful communication is? And I always say this, communication's the cause and the solution to all problems.
That's a good one.
So, all right, Dr. Doni, where can people go deeper with you?
Well, you can find me anywhere online or on social media. I'm DRDONI, so drdoni.com. This is my book over my shoulder, the Master Stress Reset Your Health book. You can find on Amazon and other booksellers. It's print, but it's also in digital and Audible.
Amazing. Dr. Doni, thank you so much for joining us here on That One podcast. I appreciate you sharing so much. We got a lot in that half hour. And I want to just, like I said, thank you. And then, also for your service and being focused on this and for women's health, because we need more people like you. So thank you.
Thank you, Mike. You too.
All right, folks, you've been listening to That One podcast with your boy C-Roc and Dr. Doni. Keep coming back. Make sure you hit the subscribe or follow button, whatever's at the top of your favorite podcast platform. And also go check out drdoni.com and Dr. Doni Wilson, on all the social media platforms like Instagram. Until next time, be that one.